Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 57 new cases of COVID-19 in Windsor and Essex County. 22 are close contacts of confirmed cases, 10 are community acquired, 1 is outbreak related, 1 is travel related to outside of North America, and 23 cases are still being investigated. We've had 15,022 cases since the beginning of the pandemic. 14,132 cases are now resolved, and 478 people are active at this time. We have 635 preliminary or confirmed variants of concern and identified in Windsor-Essex County, with 85% of our cases having the UK variant. 2 cases have the South African variant, and 141 of our cases have the variant. Of our active cases have the variant at this time. 20 people from Windsor-Essex County are currently in the hospital and 3 people are in ICU. Unfortunately, we are reporting an additional death today. A woman in her 80s living in a retirement home has passed away. Our community has lost 412 people to COVID. There are currently 9 active outbreaks in Windsor and Essex County, 8 workplaces and 1 school. Now for the vaccine update, 144,405 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 130,897 people have received at least 1 dose. Regarding our mass vaccination sites, we are currently vaccinating people 60 years of age and older across all vaccination sites. In addition, those 50 years of age and older living in one of the identified hotspot postal code areas can be vaccinated. These are neighborhoods where your postal code begins with N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y. When you attend your appointment, please bring proof of address, whether it be a driver's license, current utility bill, or other current bill. Anyone living in these areas requiring transportation, please contact Vets Cab in Windsor or Sun Parlor Taxi in Leamington. Free transportation has been arranged by the Chamber of Commerce. In addition, Transit Windsor is offering free bus service to mass clinics in Windsor. Please note that whether you are booking online or by phone, the available appointments are the same. The call center does not have access to appointments outside of what you see online. If you are booking online, please go to wevax.ca, or if you need assistance, please call the call center at 226-773-2200, and someone will be able to help book your appointment. For general inquiries regarding the vaccine or COVID-19, please call 211. We would also like to remind residents that individuals 40 years of age and older may now be vaccinated at one of the participating pharmacies in Windsor-Essex with AstraZeneca. We'd also like to remind you that despite the vaccine rollout, public health guidance is still necessary. Maintain 2-meter distance from anyone outside of your household. Wash your hands with soap and water or use an alcohol-based hand sanitizer. Wear a face covering in public spaces outside of your home. Avoid touching your eyes, nose, and mouth with unwashed hands, and stay home if you are sick and get tested if you have any signs or symptoms of COVID-19. I will now turn it over to our Medical Officer of Health, Dr. Wajid Ahmed.
Good morning, and thank you for joining us. I have nothing more to add. We can just go straight into the questions.
Today we'll start with AM 800.
Teresa or Dr. I'm not sure if you can tell us this, but the person that passed away from the retirement home, was she vaccinated?
I don't know. I'll have to double check, but I think this person died as after a complication, and the case was a few months ago, and was still struggling from that. So I don't know if it was I would call it like as a vaccine failure issue, even if this person was vaccinated or not. But I think mostly it's just because of the complication that came after the COVID diagnosis, and the person was having a difficult time after that, those medical complications.
Okay, so this individual was diagnosed with COVID, is it safe to say, a while back, a month ago, a couple months ago, and then
Yes.
obviously from that point there was complications?
Yes, that is correct.
Okay, thank you. And then one final one, just in regards to the cases for today, the one travel related outside of North America, is that related at all to the Tuesday case that was reported?
I don't think so. This is another individual, and supposedly had no relationship with that previous case.
Thank you.
Any questions from CTV?
Yes, good morning. The federal government is considering more travel restrictions, such as banning international flights. Given that we are still seeing some travel-related cases, do you think that this is a necessary step?
Well, I think we have to see that now as we are progressing further and further with the vaccine, and every country is at a different stage of vaccination coverage rate, and with the emergence of variants that's been happening in different parts of the world, it would be a concern because we don't know what kind of new variant can be introduced. So overall, having a secure border is important, and limiting the travel to for only essential reasons, or controlling it in such a way would definitely be helpful, just because every country is at a different stage of vaccination, and as Canada is improving its vaccination rate, we have to be mindful of what is happening around the world and protect our residents.
Great, thank you. And just looking for an update on the vaccination sites, what are the wait times like now to book a vaccine in the region?
So we are opening up days as we have a confirmation about the vaccine, as well as we have filled all these appointments. Typically, we open up vaccine appointment at least 1 week at a time, and it just is incremental day by day. And if we filled all the spots, we open up more days, but we don't typically go more than 1 week in advance. So anyone who meets that criteria, they should be able to get the vaccine from the time they book their appointment and get it. It should be within a matter of a week or less.
Okay, thank you.
Any questions from CBC?
Yes, good morning. The province is looking at introducing some kind of paid sick leave program or enhancement to what the federal government is offering. In your view, is paid time off and making that benefit easily accessible a priority in battling the pandemic and preventing infection?
I think it's one of the important steps to ensure that people are not reporting their symptomatic states or their COVID status with the fear of losing their pay. So I think there has to be some kind of support system in place, whether any kind of federal support or provincial support or any other kind of support to remove that barrier. And it's unfortunate that people who are impacted more, people who belong to the low socioeconomic status, they bear a higher burden of COVID disease everywhere. So adding or removing this barrier of paid sick time, I think this would definitely be helpful in early identification of the disease, and would allow better case and contact management, and will allow people to come forward and identify themselves if they have symptoms, or if they require testing, or if they require isolation. So overall, it would be a good thing.
Thank you. We're hearing that border guards have recently become eligible for vaccination registration here locally. Do you have any details to share about that rollout? And I'm also wondering if any other essential worker groups have recently been added other than the education workers that I believe Teresa mentioned recently.
So we are going through the list, and based on our vaccine supply, anyone who is in the secondary priority under Group 1, they are being considered based on the information and based on the availability of the vaccine and their relative risk. So some of that work is ongoing, and we recognize that the border personnel are included in that secondary priority Group 1. And we're trying to work on a process to get them the vaccine that they qualify under that category.
Okay, thank you.
Any questions from Blackburn?
Yes, I'll ask the answer. Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. I know you've been booking appointments for the highest risk and high risk medical conditions, people with those conditions. How is that going? Are you receiving a lot of people interested in booking appointments from those groups?
So we are filling appointments. We also had vaccinated quite a few people previously, and also people in the highest risk medical condition are able to have one primary essential caregiver booked for vaccination, and limited people that have a high-risk medical condition are also eligible to have one essential caregiver. So essential caregivers are being booked through the system as well. So, we are filling up. We're filling up every spot, and it is going well.
And do you know when you might open up that vaccination, mass vaccination clinics to those in the at-risk group? I know it's a much larger group, a lot more conditions listed there.
Yes, we haven't discussed opening it up further at this time due to the amount of people that it would open up to. And so there's this balance of the age criteria versus other prioritized groups. So that is an area we have to look at, and we're having those discussions all the time, and it really is trying to use the vaccine that's available to us across many different priorities and make the best decisions we can.
Thank you.
Any additional questions from AM 800?
Dr. Ahmed, another milestone today, just passing 15,000 confirmed cases. I know we ask you this question all the time, and we hit different milestones, 5,000, 10,000. But when you see 15,000, what goes through your mind?
The first thing is we're still dealing with this COVID pandemic. That's the first thing that came to my mind. And it's unfortunate that, our case counts continues to increase. But I think the surge that we have seen in December, January was really scary, and basically it deflated us for the most part with that many cases in such a short period of time. We are looking at the silver lining at this time that we are giving out vaccine. We are continuing to roll out the vaccine in the region, and we are covering a large number of people. We have vaccinated more than 130,000 individuals in our region that constitute roughly around 31% of our people, at least with one dose, which is, again, a great thing that we like to focus on rather than looking at the cases. Obviously, we know that just vaccination would not solve the problem. We have to do a good case and contact management, and we have to contain the cases in our community. So all of that work is important, but it's unfortunate that we continue to see cases increasing in our community, and we all have to do our part to make sure that we reduce the transmission and get the first available vaccine that's available to you.
Thank you. Have a good day.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Yes, I noticed there's a new school outbreak here in Amherstburg, and I'm wondering what are the details surrounding that outbreak, considering that schools have been closed now for 2 weeks.
So as a result of the investigation, we did identify that the case that a new case that we picked up was on the interview, and additional details were not necessarily had any other identified source. And in the past few days ago, or like almost a week ago, we had a case which was deemed as a low risk because all the personal protection or the public health measures were followed appropriately. Didn't necessarily resulted in the declaration of an outbreak at that time, but after the new case, we did found that it was reasonable to consider that there may have been transmission happen, and that's why it was reported. But overall, based on the timeline, it's still contained, and the school should come out of the outbreak in the next few days or so.
Thanks very much.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
No, thank you.
Thank you, everyone. Have a great day.
Thank you.